Health Break is brought to you by HCA Virginia Health System.
About 2 years ago, he started to slow down, and everybody that knew Dad knew something was wrong.
I got where I couldn't do anything at all. I couldn't hardly breathe. I was dying every day.
The experience of Wilbert's story is all too common. His condition is called aortic valve stenosis.
When it gets to the severe point, the heart is unable to pump blood out, and it backs up in the lungs, and they get short of breath and weak and eventually die of congestive heart failure. The conventional treatment is a aortic valve replacement, and that involves open heart surgery. Aortic stenosis happens in elderly people who have a lot of other problems, and some of them are not good candidates for open heart surgery.
Fortunately, HCA Virginia has introduced a new minimally invasive life-saving solution for these patients in Central Virginia. It's called TAVR, transcatheter aortic valve replacement.
The new approach that we've taken is radically different. With a transcatheter valve, rather than the patient having to undergo an open heart surgery, be placed on a heart-lung bypass machine, it's all done minimally invasively, typically through the leg.
The new valve is delivered on a catheter, crimped onto a catheter, put into position, and then implanted in place by balloon inflations, and begins to work immediately.
In Central Virginia, the cardiologists and cardiac surgeons at HCA Virginia have the expertise and technology to perform this new procedure.
It's done in a hybrid laboratory. That is, it's done with surgeons and cardiologists working together with advanced imaging equipment.
This procedure is really in 4 dimensions. It's the 3 dimensions that exist in your body plus time. The heart beats, so we need all of these imaging devices, modalities, superimposed on each other in real time to do these procedures.
So this is really a game changer. This new technology has really offered a new treatment option for patients who previously had very few options.
For Wilbert Story and his son Howard, TAVR was his only option.
After the operation, I done real well. I mean, I really enjoyed it. I could breathe. I didn't have to struggle for air. I feel good. I feel good.
Most of our patients so far have been in the hospital 4 to 5 days. For a conventional aortic valve replacement, many of these folks would take weeks to recover and would likely be hospitalized or in a nursing home.
These patients and their families are so happy to be back to doing the simplest things, and now they're coming back and getting back to a quality of life they may not have known for years.
Basically, he can do anything he wants to right now. He cooks, he can do some of his cleaning, does his laundry. I mean, you know, it's things that he couldn't possibly do several months ago.
We're now able to offer aortic valve replacement to patients that were not surgical candidates in the past. They were doomed to die of their disease. And now they can not only survive, but have an excellent quality of life.
Well, Enrico Doctors has a long reputation of providing high quality care. The TAVR is just the latest addition to that.
When you're down to the point where you really don't expect your dad to be with you, to even make his 88th birthday, and to go from where he was then to where he is now, it's, I mean, I think it's a miracle anyway. Dad was in a bad place. He really was, and thanks to Enrico Doctors Hospital and the Virginia Cardiovascular Specialists and this new heart valve procedure, we have our dad back.
To learn more, contact the HCA Virginia Heart Valve Center at 804 HCA TAVR.
Health Break was brought to you by HCA Virginia Health System.